Sex and reproductive health wasn't really a topic in my household growing up. Growing up in like a Native family, especially a Diné family, we never really had conversations. I basically was just told, don't do it. Some of the misconceptions or misinformation that comes from Navajos is that if you talk about it, it will come. They always say like, oh, let's not talk about it. The Janita, we shouldn't talk about this, it's negative. If you talk about the negative, you're gonna bring it in. So a lot of the elder Navajos would say like, if you talk about sex or you talk about STIs, it's gonna come into our community. But now, we don't live in those times anymore, right? We have to move forward, we have to progress. And that means we have to have these conversations. We have to have conversations about STIs. We have to have conversations about unwanted pregnancies, teen pregnancies, child sexual abuse, right? So it's finally coming to a point where we can have these conversations. We need to reduce the rates of congenital syphilis. We need to reduce the rates of chlamydia and HIV. Even though NCHN's small, we're very mighty. We really try to push education onto folks, but we also try to meet people where they're at. We're on the ground providing that sex ed. We're on the ground letting folks know that if you do decide to dip your toes into like risky behavior, not using condoms, not getting on birth control, these do have consequences. You want to make sure that you're taking care of yourself. Nobody wants STIs. So we want to have that conversation and provide that information and get people tested. And that's where education comes in. That's where our community health programs come in, is that we talk about prevention work. So we do prevention before intervention.